Hi, I'm Shantae with Sandal Blue Foundation, and I'm so glad that you're here for this resource conversation. These conversations are intended to help motor vehicle incident survivors and their families with tools, resources, and support. You guys are in for a treat. Today, we've got Kathleen from Advocates for Hope, and I'm so excited because her and I have become quick friends. And that tends to happen when you've been through something similar and learned the hard things and things that you wish you knew. So, Kathleen, thanks so much for being here with us.
Thank you so much for having me on. I'm really excited for this today.
I'm so glad. Now, before we really jump in, give us a quick introduction of yourself and what Advocates for Hope is.
Well, I am Kathleen Skeins. I am a board certified patient advocate, and I do caregiver navigation or education for those who have someone in their family who has a traumatic brain injury. My Advocates for Hope started in 2025, a year after my husband sustained a severe traumatic brain injury while we were on vacation in Aruba. And
Wow.
so, yeah, I learned all the things brain injury, travel, advocacy, rehab, and I'm here to try and help others.
I love that. And, I think most people watching are in a similar boat. It wasn't something that they had thought was going to happen. We all think it's not going to happen to us or to our loved ones. And then all of a sudden we're in the thick of it going, okay, now what? Now what do we do? Now, something that you mentioned is that you're a board certified patient advocate. What is that? Describe what that is. Explain to us a little bit more what that is.
That's funny because you give the exact same, reaction that anybody else does. They're like board certified. I said, yeah, we do exist. There, that is a thing.
Yeah.
We actually have training in like certain areas, and we have ethics, and we have communication that we are trained in, and we have to take a test and in order to become board certified. So there is a group of us that's growing rapidly, and what we are actually are independent advocates. So we work solely for the client or the families. And we do not work for the hospitals, which there are patient advocates in hospitals and for insurance companies and things like that. And ultimately, that's who they work for. But we are truly independent and do not work for
Okay.
them.
Okay. So what I'm hearing is really you're the voice of whoever you're there to help. So you're not trying to push an agenda. You're really just trying to advocate for the patient themselves, for that family. And are you also advocating for the physicians? I mean, like, how does that work where you are independent? Who are you advocating for exactly?
Ultimately, we're advocating for the patient and the patient's
Okay.
well-being. But when it comes to a scenario, especially with traumatic brain injuries, I mean, you don't know the medical lingo. You don't know what's happening. You're so overwhelmed. You don't even know what your name is. And so we're also there to help, the medical team get through to the family.
Okay.
So a lot of times you're hearing all these words and you're talking to all these people in white coats, and they all look the same and they're all saying this, they're speaking Latin,
Yeah.
they
Yeah.
and so it's really a middle person communicator, helping everybody to learn how to talk to each other, and get things across to the family that they need to understand that sometimes they just don't get from somebody else who they see at a whole different level as they are.
Okay. Yeah, that makes sense. And I know like for us, we were very versed on medical terminology just from past experiences and things like that. We had had many experiences in the hospital. We understood what the beeping was, all of those types of things. But there's still a lot of new stuff, like you mentioned. It sounds like it's a whole nother language. And it's like, wait, whoa, you just said a sentence and I didn't understand three words. Half of that sentence, I was like, wait, what? What does that mean? And it makes me wonder, what is it that families do? We'll call it wrong, but maybe they just don't know what they don't know. What do you see as kind of a common thing that comes up for TBI patients or their families when they go, I just don't know what I don't know. And then there's kind of a snowball effect because they didn't know those things.
Yeah, the biggest one is that they accept everything that's told to them because, again,
Oh,
you're looking at these people as, not God, but, they're the ones who are there to save you. They're the ones who've had the training. They know what they're doing. And quickly you can also discover that sometimes they're not as specialized as they need to be with what's happening. And so, again, that's where an advocate can come in, where we can teach like how not to just accept what's being told. And so that's probably the biggest thing that I hate to see when people, because they're just overwhelmed and they're just gonna, take what they can, to try to do the best for their family.
yeah, of course. And like we mentioned, you don't know what you don't know. And so having somebody there that can kind of say, oh, let me just explain what that meant so that you know. And then you're at least educated on how to move forward instead of, following blindly. And I appreciate that you pointed out that sometimes people just assume that what's being said is the correct thing because they don't have a personal knowledge of it. And it's important for them to ask questions and to say, hey, what you just said is this, but that doctor yesterday said that. Does that mean the same thing? Like, is this the same or where are we at? And I know for us, that happened a lot where I just would ask a lot of questions. And from what I'm hearing, advocacy, whether you're doing it for yourself or for someone else, a lot of it really is just being curious, saying, wait a minute, what does that mean? Let's make sure that we understand this before we move on. Now, when we've talked in the past, you shared that you had, a staff member or two that you really felt like helped you learn how to advocate. Would you mind sharing that story with us about how a staff member, a nurse, a doctor, whoever it may be, kind of started advocating and then you go, "Oh, okay, I can stand up for myself. I can stand up for my loved one." Tell us about them.
When I was in Miami because we were sent from Aruba to Miami and we spent 6 weeks there. And that's where I really discovered what advocacy was. I didn't realize that that's what I was doing. That's kind of just something that I've done all my life. I actually really love the medical field. And so I have no problem walking up to somebody and, I don't even care what their ID tag says, who they are. I'm going to ask a question if I need a question answered. And, I'm going to hope that I don't come across too forward, but I'm good. I discovered from, that point where they said, you are actually being an amazing advocate. And
Mm,
so, first off, they educated me on what that even was and that this was a great thing. And, so all the times I kind of felt like, oh, maybe that didn't come across right. I kind of calmed that down in my own brain. And so then, I could stay on board with all of that. But I had like the neuropsychologist. She was just amazing. She showed up actually earlier than normal, and she told me something that I had not really thought of. I was kind of doing it already, but like one of her things that she taught me was look at your person and make sure that you present them like on social media
mhm,
in a way that they would be comfortable with.
hmm,
I mean, like if you're going to take pictures of them, they don't want their coworkers to see them like that, or if you're going to, post a lot of things, just kind of be a little bit aware of what you're doing. Not everybody
mm,
needs to know everything. And so that was huge. That kind of opened my eyes. I was like, all right, that is a great thing, to advocate just for the person and their, who they are. And
wow.
then yeah, she was awesome. And then I had a few nurses and some doctors and all that too, but they were awesome. They took such good care of me, which taught me that I have to take care of myself. But if I had questions, they also taught me that um, I can get them answered, and that like because they would go, I had questions that my husband was going to get a trach, and I was a little nervous about that for some reason, that of all things, and so they actually brought the doctor in a couple times to talk with me and to answer
Oh,
different questions that had come up, and just seeing that. I didn't even ask for the doctor to come in. I was just kind of asking some questions of the nurse, and they knew exactly what needed to be done, and they took care of that for me, and they taught me it's okay, to keep asking questions. So,
Oh,
um,
I love that. And it's so interesting how, as a caretaker, you have your own needs. You're dealing with a lot, and it's really emotional and it's hard. It's physically challenging. It's taxing in so, so, so many ways. And a lot of times, what we need for ourselves is to vent about it, to be like, oh my gosh, this is so hard, right? And like to have a friend listen and validate and all of that kind of stuff. But what I'm hearing you say is one advice pieces that you got was, what does the patient feel, right? What does your loved one feel? What is going to help them keep their dignity? And that, in what I've learned of advocates, really is the essence of that is, how am I going to show up for this patient? Does that mean that we can't vent and get validation as caregivers? No, like we need that. Caregivers need that, absolutely. But maybe it's more just a text to a friend who we can, trust instead of to the whole world. And like you said, not everybody needs to know everything because when we're advocating for the patient, like you said, you want them to be able to keep their dignity. Like they're still going to try to step back into this life again. And what is that going to look like for them? So I really appreciate that. Something else that you mentioned was the people. They're like your helpers. They were like the advocates of the advocating. And I love that so much. I had similar experiences where I'm just asking questions because I'm curious and it helps me to better understand. It helps me better to communicate to my family members about what's going on. And then they say, hey, yeah, let's get these things answered for you. How do people find those? We'll call them the helpers, right? Our advocating helpers. How do they find those people, especially in hospital when they're inpatient still? How do they find those helper workers?
that's a really good question because you just trust is a huge factor. I mean, you have no control really over what's going on right now, and so who do you trust?
Yeah.
And you start to get like gut feelings, and a lot of people ignore those. And you really have to start to calm yourself down, listen to your gut and the people that you're talking to, and really think about how they're responding to you and how they're answering back. And you know, stay curious with that. And the people who do stay curious with you are your people,
Mm,
and I love that you said that word because that's something that I have tried to use as well. Is I was always very curious. What does this machine do? What does that do? I was learning about the respirator, and the ventilators and all that, which is something that hardly anybody will even go anywhere near. And,
yeah.
I had people who would stop and who would answer me. And so that's how you find them. And,
Mm,
the people who would do things like that nurse who went and, would get somebody to answer something that he thought I had that was stewing, without me ever even asking for it. And just you have to kind of start to really pay attention. But not everybody's going to be there. I mean, you're going to
yeah.
have so many people coming in and out the doors, and you'll be able to feel it, And but so this is where you really have to start to listen to your own, your own gut.
Yeah, I love that description so much. People have asked me similar questions, and I've said the same thing, and they look at me like, really, a gut feeling. And I'm like, there's really not another way to describe it besides we all connect with different people, right? Like one nurse might really connect with you and not with me at all. Like there is something to be said that everybody's different for a reason and for beautiful ways because different patients need different type of workers. And the other thing that I think is so important is to be able to talk to the workers that are there for a long time, right? Like nurses are usually on shift for 12 hours. They don't usually have something they have to be doing all 12 of those hours. And so they're a really easy person to pull aside and be like, do you have 10 minutes? I need to ask you something. Where when the doctors are doing rounds, they have like 5 minutes a patient. And so it's really hard to be like, hey, I have 45 questions. So if you can go through them with the workers, that are going to be there longer. And then you can ask them, like if it's somebody you connect with and you feel comfortable with, there's that trust factor you talked about. You can say to them, hey, I have two questions that are really important to me to get answered during rounds today. Will you come in the room when the doctor comes in and make sure that I ask them? You can advocate for them advocating for you. And all it is just an asking. It doesn't, even if you're introverted, you don't really love to, work with people like that. It's just a really quick one on one, just saying, hey, can you help me with this? I really could use the help. And 9 times out of 10, they're going to be like, yeah, I would love to do that, especially if you've connected already. So it's such a good way to look at it. Now, what are some of the things that you feel like every caregiver should feel comfortable asking? You mentioned, the machinery and what's going on with it and how is it being used, but are there other things that you feel like caregivers should absolutely think, I have the right to ask this and not second guess it?
There, we could do a whole video on that alone, but you mentioned the about one doctor says this one day and the other doctor said this the other day. I did have a little bit of that too. So one of the first things you can do when you walk in the morning, you don't have to ask the doctors, but you can ask, all right, so who's the head honcho today? Who's the guy
Mm,
in charge? Who's the lady in charge? And because I'm going to try and follow what they're going with today. And if I have questions about what was said yesterday, then I know who to go to find out, where's the communication or what am I misunderstanding?
I love
And
that.
that's one thing that I think that they should all be, feel that they fully have, right to talk to that person. And the other thing is asking for things to actually be put in writing. A lot of people don't think about that, but even if it's just that they put it in their notes and they put it in the chart, something that, you asked a certain question, you got a certain answer, you didn't quite think that that might be what was going again in your gut, and so have it written down. And just, ask in a nice way, just can we
Yeah.
make sure that we keep these notes, because I'm not going to remember these, in a couple days. So
Oh,
those
that's
are probably
so
two.
smart. Yeah, I think that that is so smart. I always recommend to people to write down their questions, whether it's on, a whiteboard in the hospital room or in a notebook, because then that way you can go back and go, oh, I forgot these three things. Hey, my nurse friend, make sure I ask these tomorrow. But I've never thought about having them write down their responses. And I would imagine that what happens when they have to actually articulate it in a way that's slow enough to write it down, that they probably say it on a level that's easier to understand and they can see past people's answers and go, oh, wait, I didn't realize they had told you this. Let me explain why we're doing it different. That's genius. Such a genius idea to have people write it down. I love that. Now, we've talked a lot about advocating in the hospital. And traumatic brain injuries are very complex and they take a very long time, as we know. It takes about, luckily, the brain has a couple of years of healing time that it can go through. But what about advocating once the patient's home? That transition is so hard, first of all. Let's validate and recognize that for everybody. That transition and coming home is really challenging for everybody. Very normal. But how do we keep advocating once we're home? We don't have somebody coming around all the time. We don't have a nurse that's on shift for 12 hours. Like, what do we do once we're home?
Oh goodness. Um, just remembering my coming home. My situation it has been amazing compared to what some people really have to do, what they have to
Yeah.
deal with. But you know, I would go back and I would specifically ask for what are the things I need to look out for? Because
Mm,
when we get home, you know, this person has not been home. They might not even remember where, what home is,
yes.
but so you guys are watching them 24/7. When I get home and I'm watching 24/7, what do I need to look for if there's changes and there's things that I need to be aware of and make you aware of? Because again, some things might not be quite as important as you think, and you're going to
Yeah.
be on high alert. I mean, your
Yeah.
anxiety is going to be sky high, and actually, their anxiety is going to be sky high too. So, another thing that I found I really needed was somebody that I could reach out to in a hurry if the patient or the family member's anxiety got out of control and you
Mm,
really needed something extra that they did not have on board, like extra medications or things like that, um, that they didn't have on board when they left the hospital. And I discovered that that happens more than not, that the people get home and they've got, they have a lot going on in their brains, and um, they've been in the ICU for a long time, and then all of a sudden now they're at this place, and they're trying to just bounce back into their old life and they can't,
yeah.
and internal struggles. So those are probably some big things that I would say. Um, Another one would be to have the medical documentation, especially from the initial injury, and then also the last list of medications in an actual folder that you can have with you at all times. Because if something happens and you have to go to a hospital or you have to have an ambulance pick you up, you want to hand this to them and let them know what they're dealing.
So
You
smart.
know, yeah, and even maybe a go bag for yourself, just a little bit of stuff, to have that you can grab, and because you have to think about yourself too. And
Yes.
yeah, and I know that a lot of it's a hidden disability, so a lot of people don't look like there's anything wrong with them, and they're answering questions, and
Right.
those answers are wrong,
Right.
but you're like, no, you need to read this paperwork here. These are the answers that you want. Just stop talking.
Yeah. Yeah.
Yeah.
Yeah,
Mm.
I love this because what you really talked about was, I'm going to call it opposite things. It's not really, but you're talking about asking, what do I need to actually worry about so I'm not overly worrying, right? Like, what are the things I really need to actually watch for versus what am I just freaking out about because I'm human? And then the kind of the other end, okay, when things maybe don't go right or we need more help because we're worrying about the things that need to be worried about, being prepared for that, having something ready for ourselves, for the patient, and then also for the medical teams that are going to be working with you. That's such a genius idea. This is kind of a funny random question that popped in my head, but where do you keep this paperwork? Like staple it on them like a bib, like okay. Like does it
Written
matter
on their
where?
tag.
Yeah.
Yeah, written on their tag. Yeah.
Yeah, where are we keeping this? Just somewhere that's
Mhm.
accessible. Is that kind of what you're saying?
Yeah, yeah.
Okay.
Like, even if it's just in, I actually have started to create for people a medical binder, where it's got more stuff in there than you could possibly imagine. But
Yes.
even if you've just got like a couple things in there in just a small envelope, and say it is near where you keep your shoes, something like that, and
Okay.
you can even use, if you are able to update a thumb drive, you can do that. And there's apps that you can also have if you're really, into technology. There's all kinds of apps out there that are great, and you can update stuff like that and have it there all the time. But when you're in a stressful moment, and like firefighters and ambulance guys, they don't have time to read the apps. But
Right.
you know, yeah, and I mean,
Having something.
you have your medical charts, but again, you have to search through them all to get what you need, and so it's just easier to.
I love that. And something you mentioned, is like that you help people create a binder. And if somebody listening to this is still in the hospital, just know at discharge, you're going to get a lot of paperwork, like a lot. Lots of educational pieces, which are really helpful. And at the time when you're getting them, it feels a little bit overwhelming because it's so much information. And I personally recommend voice recording those conversations so that you can go back to them and go, what what did they tell me? Because it's like a fire hose kind of at discharge where you're getting so much information and it's important, but it's hard to retain. And you talked about a binder, but I had so many binders um, from different discharges because we had multiple people in our family. And so I actually just created a bin, a bin that had everything, all of our educational resources that we received at discharge, because there were times that I was like, is this normal? Is this okay? Should I be on high alert right now? And then you have one spot that you can kind of go back to re-educate yourself and go, no, I don't need to freak out yet. Or yes, I do need to get some help to make sure that we're doing okay. So, really, really good tips. This is so helpful. Now, before we close up, is there one or two things that you feel like either traumatic brain injury caregivers or patients should know, or people that are really just trying to increase their own advocacy for themselves and their families?
Advocacy, it comes from the heart. I mean, it comes from a place of goodness and of curiosity and of you're hopeful and you're optimistic and don't lose sight of that. So people, and in the traumatic brain injury world, you're going to hear horrible things,
Yeah.
and again, it could be that you might not be at like the level of care that you need to be at, so take everything in stride, don't ignore it, but stay hopeful, stay optimistic, um, stay curious, just to show that these doctors are not, you know, they're not able to say exactly what's really truly going to happen because the brain is such an amazing thing. And there's research and there's new stuff that's coming up every day. I've learned
Yeah.
so much that, like, I was told actually in Aruba and in Miami that it was probably a fatal injury for my husband. And if you could see him now, you would have no idea that he even has a
Wow.
brain injury. Yes, our story is quite amazing. And I want other people to have that story. I know that's not always possible, but I think, staying optimistic and, is huge. Don't be delusional, but,
Yeah.
you know, uh, and know your person too. If your person was a strong personality beforehand, they're going to be a handful, afterward. But that's also going to be a good thing too, because they're going to have that strong personality and they're going to want to get things done. And or if they had a personality where maybe they had some troubles beforehand, that's not going to go away either. So just be prepared, for a lot of things. Everyone will tell you that over and over again, but it'll hit you when you'll remember that, yeah, I needed to be prepared for this.
Absolutely. That's such a
Mhm.
wonderful thing to end on. Just be realistic, right? We can't change the things that we can't change, but keep hope alive. That's something that we're really focused on at Sandal Blue is solution focus. What can we do with this, right? We're not looking to change what's happened. We can't. And so what can we do with it? How can we create a new purpose for this life? How can we find a light and a hope to move forward with what we've got now? And please, please know that there are people out there that are wanting to help you and to advocate for you. There are so many resources on Advocates for Hope website. You can find that information in the show notes as well. Lots of great information about TBIs and the different transitions that there are and questions that come up often. So feel free to check those out because there's a lot of really great resources. Kathleen, thank you so much for spending some time with us today.
Thank you for this. This was great. Your questions were amazing. I really appreciate this, getting this word out to other, people that we're out there, when we want to help and we know it's painful, but
Absolutely. And I think that's the most important thing for everybody to know is that there's so many people that are ready and willing and able, capable, wanting, having a heart to help you. So don't ever stop looking for the people and the things that you need because we're here. And with that, we hope your road gets a little bit easier.